Hi folks, I've asked the Deputy Chief Medical Officer, Dr. Jenny Harries, to come here to Downing Street. Tell us about the value of wearing face masks. You see face masks around the place. Is there any point to that?
If a healthcare professional hasn't advised you to wear a face mask, it's usually quite a bad idea. People tend to leave them on. They contaminate the face mask and then wipe it over something. So it's really not a good idea and doesn't help.
One of the reasons that people wear masks is they think that it's going to protect them from virus. But the virus isn't floating around in the air, so it's not protecting me against anything because it's not there. It's probably going to be on my hand because I've shaken hands with someone who's got the virus, and I have transmitted it. I have carried the virus to my face. If you're in an environment where everybody else is wearing a face mask and you're not, then it may make you feel vulnerable because you feel like you don't have the protection everyone else does. But logically, if you're not close to people, they're not coughing and sneezing on you, then a face mask isn't necessary.
Our approach is to be guided by the science.
We are guided by the science.
All of the science and all of the decisions, if you like, advice to the government is being based entirely on science.
At all stages, we have been guided by the science. The scientific advice, the best scientific advice, we will continue to provide, as soon as we have it, as much clear scientific and medical information as we can.
So, as a professional, I'm absolutely delighted that we are following the science and the evidence.
And it's because we back the science and because we've taken an approach that's guided by the science that we've been able to deliver this result. Thanks to the brilliant scientists at Oxford University working with the NHS and funded by the government, we've been able to develop the science. In truth, UK life sciences are leading the world in vaccine development, in the development of treatments, and in immunology. But it's by working together that we've been able to bring this result to bear.
When we are confident on these 5 points, guided by the science, guided by the data, but in formulating the right balance, we will be at all times guided by the scientific advice.
The government's advice on face masks has changed throughout the pandemic. In previous months, ministers have described the science around them as being weak. However, after the World Health Organization changed its advice to wear face coverings in public spaces at the beginning of June, the government changed its position.
In terms of wearing a mask, our advice is clear that wearing a mask if you don't have an infection really reduces the risk almost not at all, so we do not advise that.
The Deputy Chief Medical Officer for England, Dr. Jenny Harries. We're very grateful that you're coming along to talk to us today. This is also, as well as being on the news channel and BBC Two, on the BBC News Facebook page and the BBC News website. Let's get this question now from Hazel in Horsham, who asks, why are people here not wearing masks, although clearly some people are? And she asks, even if not very effective, when there is sneezing nearby, masks would help to stop hands touching face.
So that's what we would all think, and it's very reasonable to think that logic. It is not what happens in practice. So just to be clear, if a healthcare worker advises you to wear a mask, perhaps if you are a case to prevent any virus coming out, then that is when you should wear one. And healthcare workers and care workers generally are also given advice about when they should wear it, but that's a different group of people. For the average member of the public wandering down the street, this is really not a good idea. What tends to happen is people will have one mask. You can imagine they don't wear it all the time. They'll take it off when they get home. They'll put it down on a surface that they haven't cleaned, or they'll be out and they haven't washed their hands. They'll go and have a cup of coffee somewhere. They half hook it off. They'll wipe something over it, they'll put it back off, and in fact you can actually trap the virus in the mask and then start breathing in. So
they could be putting themselves more at risk by wearing a mask than not?
It just doesn't. So yes, because of this issue of, if you like, behavioural issues, which are really important when we're talking about infectious diseases, people can in fact adversely put themselves at more risk than less. So if you're advised by a healthcare worker to do it, if you are a patient, then do. healthcare workers and social care workers, helping people will be different, but for the average member of the public wandering down the street, not what we do, I certainly won't do it. If you are an ordinary member of the public, the evidence is not good. The trials suggest that for two reasons. I think one is it's effective potentially if you are a patient to prevent the virus being coughed out. But for most people, actually, they tend to get a mask, and it's a behavioural issue as well. They put it on, they take it off, they'll perhaps put it down somewhere where they'll get the virus and put it put it back on again, and therefore in some ways they may actually risk catching the disease rather than preventing it. So routinely we don't recommend them.
The evidence on face masks has always been quite variable, quite weak, quite difficult to know exactly, and there's no real trials on it. And we've undertaken a review. We'll give our advice to ministers and they'll make decisions about what to do around that.
Many countries have been buying face masks, as have we, but the position on face masks is unchanged. When the evidence around the use of masks by the general public, especially outdoors, is extremely weak. I'd say is that on face masks we are guided by the science, and the government position hasn't changed. Professor McLean will explain the science. The government position, the UK government position, hasn't changed. Not least because the most important thing people can do is the social distancing.
The recommendation from SAGE is completely clear, which is that there is weak evidence of a small effect in which a face mask can prevent a source of infection going from somebody who is infected to the people around them. But the answer is clear that the evidence is weak and the effect is small, and we've passed that on to our colleagues in government with which to make a decision.
I can announce that as of Monday the 15th of June, face coverings will become mandatory on public transport. That doesn't mean surgical masks, which we must keep for clinical settings. It means the kind of face covering you can easily make at home.
We've therefore come to the decision that face coverings should be mandatory in shops and supermarkets. Last month, we made face coverings mandatory on public transport and in NHS settings. Under the new rules, people who do not wear a face covering will face a fine of up to £100 in line with the sanction on public transport. The liability for wearing a face covering lies with the individual. Should an individual without an exemption refuse to wear a face covering, a shop can refuse them entry and can call the police if people refuse to comply. The police have formal enforcement powers and can issue a fine, and we fully expect the public to comply with these rules as they've done throughout the pandemic.